The Move Your Way logo appears on a green background. Get to know the Move Your Way campaign. A slideshow of pictures moves across the screen. People of various genders, ages, body sizes, and races do different kinds of physical activity. People in our communities need physical activity to be healthy. And the Physical Activity Guidelines for Americans clearly states how much activity people need based on the latest science. A booklet appears. The cover reads, Physical Activity Guidelines for Americans, 2nd edition. But most people still aren't getting enough. And that's where Move Your Way comes in. Move Your Way is a national campaign launched by the U.S. Department of Health and Human Services to help Americans get active. 3 short video clips of people getting active are shown. 2 pairs of people play tug of war in a park. A person with an amputated leg swims laps in a pool. And a crowd of children and adults ice skates at an outdoor ice rink. The screen switches back to the Physical Activity Guidelines booklet. The booklet flips open. The Move Your Way campaign adapts the Physical Activity Guidelines into information everyone can understand and use, no matter their age, abilities, health status, or fitness level. An infographic appears. It shows the recommended amount of physical activity for adults, which is at least 150 minutes of moderate intensity aerobic activity a week, plus at least 2 days of muscle strengthening activity a week. Move Your Way aims to reach people who aren't active enough yet, but who are thinking of making a change. And to reach them, Move Your Way is changing the conversation about physical activity. The infographic disappears. The Move Your Way logo appears on a green background. Being active has great health benefits, but for many people, getting active isn't easy. They're surrounded by messages that make physical activity feel unachievable, overwhelming, and all or nothing. 3 short video clips are shown. A young white woman looks at a treadmill that is covered in clothes. She looks discouraged. A middle-aged white woman sighs in frustration as she looks at a dry erase board on her fridge. It reads, "Remember to jog 30 minutes after work." A white pregnant woman does jumping jacks in her living room. She stops and touches her lower back with a look of pain on her face. Move Your Way shows how manageable and adaptable physical activity can be, and how to work around barriers like lack of time or access to facilities. While the narrator speaks, 3 new video clips are shown. A black man vacuums while doing lunges. He's smiling and listening to music through his headphones. Next, a black family washes their car. The mom and 2 teenage kids are scrubbing the car, while the dad, who uses a wheelchair, sprays water with the hose. They look happy. Finally, a white mother and black daughter do push-ups in their living room. They smile at each other. The screen switches back to a green background. A checklist appears. Move Your Way means lots of things count as physical activity. Even everyday tasks like cleaning your house and walking your dog. It all adds up. Even a few minutes of moving more each day has real benefits. Find activities that work for you, so it's easier to stick with them. A new checklist appears. In the background, images of different Move Your Way materials move across the screen. Move Your Way is ready to use with a suite of fact sheets, posters, videos, and interactive tools, tailored to different audiences like older adults, parents, kids, teens, and pregnant and postpartum people, and based on people's needs. Move Your Way materials are tested with diverse groups of people to make sure they're clear, informative, and accessible. And all materials are available in English and Spanish. Spanish language versions of different Move Your Way materials appear. It can be hard for people to get active on their own, and that's where you come in. Community organizations like health departments and nonprofits can use Move Your Way to help their communities get active. While the narrator speaks, a slideshow of short video clips scrolls across the screen. It shows people of different races and ages, including a man and woman using a public bench to do muscle strengthening exercises, 3 women doing yoga in a park, a diverse group of men playing wheelchair basketball, a man and woman running on the sidewalk, and a diverse group of children at a martial arts class. You can make Move Your Way work for your community, whether that means starting a brand new local initiative or using Move Your Way materials in your existing activity programs. A social media message appears. It has information to invite people to a virtual kickoff event for a local Move Your Way campaign. The screen switches back to a green background. Images of Move Your Way events and materials appear. Do it your way. Plan events, big or small, that make sense for your location. Use Move Your Way's ready-made materials or adapt them for your community. Post Move Your Way's grab-and-go social media messages and graphics. Or start your own social media challenge. A map of the United States appears. Colorful pins mark the locations of 10 communities. And you don't have to start from scratch. 10 communities across the U.S. tested out Move Your Way with events, new programs, and social media messages to get people in the community moving. Images of different materials appear. Their experiences helped inform a community playbook with tips and materials to help communities of any size, location, or budget promote physical activity. The playbook has resources to help you do things like plan community events, build a budget, work with local schools and businesses. The Move Your Way Community Playbook logo appears. Everything you might need to bring Move Your Way to your community. A link appears. It reads health.gov/moveyourway/playbook. You can find the playbook on health.gov as part of the Move Your Way Community Resources website. Here's how 3 community partners describe their experience with Move Your Way. A speech bubble appears and is narrated by Melanie Seiler from Active Southern West Virginia.
Move Your Way is really key to Active Southern West Virginia's health education efforts.
A photo slideshow starts playing. We see 2 white women wearing face masks and protective visors holding up a Move Your Way fact sheet. Move Your Way materials on a table at a community event. Children completing an obstacle course outdoors. And a young white girl holding up Move Your Way fact sheets at a campaign event.
It gives us a way to interact with our audience online and through partnerships. We use the community playbook to identify partners and work with them on a health education campaign. For example, we partnered with a local library in a small West Virginia town to add an obstacle course to their bookmobile program, and then to distribute the Move Your Way fact sheets for kids. Now kids can get their dose of physical activity when they come to get books and use the free Wi-Fi.
A speech bubble appears and is narrated by Michelle Lewis from the Siouxland District Health Department.
Before Move Your Way, the Siouxland District Health Department used different campaigns, curricula, and programs at the same time.
As she speaks, a slideshow of photos plays on a screen. It includes people tubing down a snowy hill, a diverse group of mothers exercising in a park with their babies in strollers, and a photo of branded goodies with the Move Your Way logo, including a Frisbee and a sports bag.
Having one message has made our work easier and more impactful in the community. People now see Move Your Way and know what it's all about. For example, we partner with local healthcare providers and clinics to reach pregnant and postpartum people. We distributed over 2,000 bags with Move Your Way fact sheets and goodies to expectant parents in our area.
Speech bubble appears and is narrated by Mindy Meacham from the Southern Nevada Health District.
The Move Your Way resources were easy to adapt for our organization's needs.
A photo slideshow plays during the narration and includes women shaking hands and smiling after finishing a race, a Hispanic father and son playing indoor basketball, families taking a walk outdoors, and community members engaging with Move Your Way tabling materials.
The Southern Nevada Health District serves just over 2 million residents, many of them native Spanish speakers. We were able to pick and choose what we needed and find fresh ideas to reach our communities with voices they trust and are ready to engage with.
The Move Your Way logo appears on a screen, along with colorful icons showing people doing different kinds of activity. Now it's your turn to move your way and get your community moving too. Find all the Move Your Way resources at health.gov/moveyourway/community resources.